to not only speak to Barbados and Barbadians, but to speak to the global community. I've heard many say that the time for global coordination and partnership has passed in this pandemic, that the horse has already bolted from the stables. I want to say definitively this morning that in our view, that is not the case. And there is never a wrong time to do the right thing. The fact that globally we continue to run this race, trying to fight it up and to beat it against mutations and variants, tells us that there is still a great need for global coordination and partnership. We know that without this partnership, we're unlikely to win the race in a hurry. Once we don't win the race in a hurry, it means that we are going to be challenged by the mutations and the variants that come about, as we are seeing today with the WHO only yesterday reflecting that the variant in India is a global health risk. This is from a country that has 18% of the global population. If ever there was a need for the world to stand up and recognize that we need a global summit for coordinated action with respect to how we treat to the COVID pandemic, how we treat to the equitable distribution of vaccines, how we treat to the restricted movement of people and countries in a coordinated way to give the global community the best chance of putting this behind us. In the spring meetings that just concluded, the World Bank and the IMF, we were clear that there is going to be no serious global recovery economically until we wrestle COVID-19 to the ground. We cannot wrestle COVID-19 to the ground unless there is vaccine equity and unless there is coordinated actions across countries and not by single countries, one by one by one. I therefore use this opportunity this morning, first and foremost, to remind us at the global level that there is nothing stopping us from a global summit other than us. If ever there was a need for political will in the post-1945 world, it is today as we speak. And I trust and pray that there will be movement among those of us who have the responsibility to have the charge of our populations under our control as governments, for us to do the right thing and to do it together. For us locally, we are in a daily battle. We have done well as a nation, but we cannot at any time drop our guard. The reality is that on a daily basis, the Minister of Health and his official Chief Medical Officer and the Permanent Secretary and all of the others working in this sector at the policy level, and then those who are working on the front line of the delivery of care, like our doctors and our nurses, all know that we cannot afford to drop our guard. I ask Barbadians to reflect on the fact that we can only get out of this if we work to reach herd immunity. And for that to happen, it means 1 + 1 + 1 + 1. For those of you who are hesitant or have issues, we are more than prepared to answer your queries and to ramp up the level of public communication. As I said, we have done well with over 75,000 vaccines being administered through our public health system. But we need to do better in order to get to that point where we can be assured that we can have some level of normalcy, as Sister Serrano said, in our system again. The truth is that there are people out there who want, but there are still people out there who don't. And we have therefore to address these doubts and fears and to remind persons that those who put information out there in a context that doesn't have anything at all to do with our reality are not helping us. Why? There's some who are concerned about the side effects. There are side effects with everything in life. There are risks with everything in life. But the question is the risk worth it? The bottom line is, on today's front page, we have Dr. Ford reminding us that it is our young people now who are being affected more and more. And with the particular strains that have developed, that is what others are seeing across the world. We have therefore a responsibility to ensure that we can control this, and that as many people who want to take vaccines should be allowed to take vaccines. And that is why our government continues to contract and to procure additional vaccines. We're at a stage now where we expect and believe another major shipment, and hopefully that will get us to where we need to go with our adult population. And now we have then start to focus on those under 18 with respect to vaccinations.